Executive Karen. And our last speaker is Penny Postoak Ferguson, County Manager of Johnson County, Kansas. Penny, the floor is yours.
Good morning. Thank you for having us in this format. I appreciate it. It was great to hear from the others as well. Like my Ohio friends, we are in the middle of the country, and so how we are impacted, we get an advantage of watching other places in the country and then responding and making adjustments. Sometimes we have benefit of earlier warning signs in other areas of the country. For Johnson County, we like the other two speakers today and many counties, we oversee emergency management for the county and we oversee public health for the county. So for this to hit our counties, it has a great impact on the decisions that have to be made locally in conjunction with the state government, federal government, and our unique situation is that we are located in the Kansas City metro area. Johnson County has a population of approximately 600,000 in a metro area that's about 2.4 million. And Kansas City, Missouri is the largest city in the area of roughly 500,000. So it's interesting because we also have 9 counties in the region. And within Johnson County, we have 20 cities to work with. So we have a number of stakeholders that makes coordination quite interesting when there's different rules on opening, closing, funding sources, et cetera. So we have a lot of collaborative groups working together, and luckily we have many of those in place before COVID hit. We had our first case on March 7th, so since then we've been quite active. We had our first stay-at-home order on March 22nd, and we were collaborating very closely with regional partners in the beginning, and then because there's so many decision makers, we try to collaborate, but it becomes more and more difficult to continue to do that. So it gets confusing in a metro area when you can go a couple of miles and be in a different jurisdiction with different rules. So we focus a lot on communication for those reasons and others. Our health department has a robust plan of testing and contact tracing that has evolved during the pandemic, and so we're very fortunate on that. As far as communications, one tool that we have had in place is a system called Notified JOCO, and that's where you can quickly get text messages, and I'm sure that other counties have messaging systems for emergencies and other things as well, but we could set up those fairly quickly. So, for example, we had a need to talk to our superintendents when everything first started hitting about, what the schools do, and they wanted to work with us, and they needed to work with the state. And so we were able to set up focus group really quick and talk to our 6 superintendents and get that discussion going, for example. And I do have a weekly call with the 20 city managers, and then we have regular communication with the surrounding communities. And so communication is key. And then when you also have 4,000 employees and 80 plus different sites for just county facilities, we also have 190 programs. So trying to figure out how to keep those going. With the exception, so we closed our buildings for a few weeks, but the services that were impacted temporarily were parks, libraries, and Department of Motor Vehicles. But other than those facilities being closed and then therefore impacting services, we provided the vast majority of our services just differently. As the others spoke about, we did some things through mail, we did some things through appointments only, we did some things a lot through technology, and so we're learning how to rely on that much more. As far as budget impacts, well, we have a budget of just over $1 billion, but if you pare back, take out of that reserve, you take out of that enterprise funds where they're self-supporting funds, and you get to the general fund plus a few taxing funds, that's roughly $315 million working budget. Out of that this year, our biggest revenue source, about 2/3 of that $315 million is property tax. And so property tax for us has been very stable. Even through the recession, the Great Recession, our property tax remained very stable. We had a uncollectible rate that was only 2.1% at the high point during the recession. So luckily, our largest source is very stable. We do have sales tax in there that's not near as stable during this time. So for this year's budget, we are at 97% collection of the property taxes. So we're fortunate there. It doesn't mean we're in the clear. It doesn't mean that we're not hurt. We've had to find our revenue sources collectively were down $25 million for this year's budget. So we did that through a hiring freeze and vacancy savings as a result. We also did furloughs. We also held expenses. We also deferred and delayed some capital projects. And so we are just starting to look at the 21 budget and looking at how for a short period of time we can do these things. So we were able to make $25 million in a quick amount of time, contingency plan, because we see them as temporary to get us through, meaning get us through to the end of the year. We know COVID impacts are going to be a lot longer. So like the others that presented before me, this is really an impact for 2021, 22, and beyond, but probably most impactful to us as the county budget probably in 2021 and 22. So as far as the federal funding, it's greatly appreciated. We are spending those funds on a lot of our services, just like the other speakers talked about. Our top priority with those funds are testing, contact tracing, epidemiologists, support, trying to understand how the disease is behaving, not only for Johnson County, the metro area, in coordination with the state and the region. And so, and then our frontline workers, like the others talked about, and there's a vast number of services, mental health. We want to look at how it impacts on our elderly population, transportation, really looking at how do we make investments with the digital access, so that those that are more vulnerable or maybe don't have digital access for either public health communications or their well-being, that we make investments now that could have lasting impacts with those funds that help us through this COVID time. So really the flexibility is, I would echo what those have said before me, in that having a multi-year funding strategy is the key. The amount of federal funds that Johnson County has received is in excess of $116 million, and there's a lot of good that can be done with that in the areas that I've talked about and others, and working with our other community partners. However, I would say the top of the list is really, even if we have that level of funding, to be able to not have to spend it by the end of 20, because we would love to have ongoing testing, contact tracing, PPE beyond 20, because it's going to be needed in 21 as well. So that's probably the top of our list, is the flexibility on the time frame to use it. Also, as the others have spoken, the projected revenue loss for 20 and 21. So far, the restrictions have been focused on the expense side, and I understand there's discussions to possibly add some flexibility there, and any flexibility is appreciated, and consideration for the revenue loss that has impacted our economy and our community. And I would just say that finally, that the struggle that we all face, especially at the local government level, is the balance between economics and what it's doing to everybody's well-being in our community that we work so closely with the public health. And sometimes they really do work hand in hand, but the decisions have been very tough and very stressful at the local level, especially for our elected officials, because when all of a sudden your Board of County Commissioners becomes your Board of Public Health, they're in a situation to make some tough decisions for the community. And I really appreciate the elected officials that are with us in this, and the staff that have pulled together to continue to provide most of our service through this time and be creative and pull together to find these financial cutbacks where we can.